is it all in your head? Is your pain all in your head? Well,
hold on, man. We gotta tell him. No, I don't care what the doctor said. We gotta tell him now.
Ricky, the doctor told us that we should let you work it out in your own sweet time, but Ricky, you can walk.
What'd you just say?
He's telling you the truth, man. It's all in your head.
You sick.
guys, it's Dr. Renez and welcome back to my channel. If you're new here, welcome. I really hope you stick around and you find the information I share on my channel very helpful to you so you can live a better and healthier life, mind and body. Yes. So before we get into this video today, I just want to make the disclaimer. This information I'm about to share in this video is not for you to self-diagnose. You always want to consult your healthcare provider or your mental health provider if you have any specific questions or concerns. This information is to help you feel a little bit more empowered so that you can advocate for your own health. As a doctor of chiropractic, there's no surprise that a lot of my patients come to me with neck pain, back pain, sciatica, headaches, and things like that. And a lot of those issues, a lot of those complaints have to deal with some type of nerve impingement. So my goal is always to educate my patients. I always like to ask them about their stress and how the stresses in their lives may be contributing to some of their symptoms. So what truly is stress, and is it truly harmful to our bodies, or is it just something that doctors say as a default when they're not sure exactly what's going on with you? They've done the x-rays, they've done the MRIs, they've done the tests, and they can't truly figure out what's going on, so they might diagnose it as just being stress related. Well, let's answer this question. For a simple definition of stress, it's just our body's natural response to any external or internal pressures. It could be mental, emotional, psychological, or physical. For example, you have issues with work, you're stressed about work, you're stressed about your finances, or emotional, you're grieving, you lost a loved one. Psychological, you're dealing with anxiety, you're dealing with depression. And physical, you're working hard, you're always on your feet, you're lifting heavy weights. Those are all examples of stresses that could cause our body to go through a physiological response, and that is the stress response. So three main things happen when our body is going through the stress response. We have an increased heart rate, increased constriction of our blood vessels, and muscle tension. Stress is not always a bad thing, but like everything in life, too much of one thing is not good. Acute stress could help us achieve some goals. It'll help us get the presentation done. You meet our deadline at work, make the money that we need to pay our rent tomorrow. So acute stress is okay, right? But after we go through a stress response, our body's supposed to relax, rest, and digest. The problem is when stress becomes chronic. There's no in between. We're constantly going through these physiological changes. You have increased heart rate, increased constriction of your blood vessels. Hence why stress can cause serious conditions such as heart attack and stroke. So let's get into how specifically stress can and will affect our physical body, especially when it comes to the muscle tension, and nerve damage. And like we mentioned, chronic stress could lead to increased muscle tension, and particularly our postural muscles, so muscles in our neck, our shoulders, and our back, the muscles that help us sit upright, walk, bend, twist. All those muscles are being affected by chronic stress. Constant tension in those muscles. We have different nerves that runs through muscles, under muscles, and that constant tension will eventually lead to some type of nerve impingement. And with that, you will see symptoms such as numbness and tingling down your arms. You have sciatica in your legs. And of course, that contributes to the pain that we feel in our neck and our back. So inflammation. So when our body goes through the stress response, the fight or flight, it releases a hormone called cortisol. And when our body has an increased level of cortisol, that will create inflammation, especially around the nerves. Imagine you have a nerve and then you have swelling, inflammation around the nerve. It's going to get irritated. This is a prime example how inflammation can cause irritation around the nerves, especially the one exiting through our spine, and cause an increased pain. Let's talk about posture. For example, if someone is coming to attack you, and this is an extreme example, if someone is attacking you with a weapon and you're not going to fight back and you're trying to hide, naturally we will do this, right? Trying to curl up in a ball. That's our natural posture when we're in danger. Our brain does not know how to differentiate when we're in actual physical danger or when we're just thinking about it. So the constant worry and fear and anxiety have the same effect on our body. So you may have a slump posture, a hunched over posture. That could be a result of chronic stress, and this unnatural and constant posture again could cause compression on our nerves, leading to more pain. Your posture, our posture, my posture can say a lot about me, because I know, for example, when I'm really stressed, this, especially my right shoulder, hikes up. So this is when I'm in a very stressful mode. This is how I know, because my posture, again, this might present differently for everyone, but this is an example for me. Some people it's the jaw, some people it's the back, some people it's the glutes. We hold tension in different ways, and improper posture can lead to increased pain. Chronic stress can and will affect our blood flow. Blood vessels are constricted. There is less blood going to our muscles and to our nerves, and blood carries oxygen. So lack of blood flow, lack of oxygen to our muscles and nerves, again, will and can cause increased pain. So, is it all in your head? Is your pain all in your head? Well, based on the information I just shared, we all know that the answer is no. Yes, our pain center is in our brain. Our pain is processed in our brain. However, your symptoms that you feel is real. I really want you to understand. Yes, your pain is real. However, how we control and manage our stress, meaning doing the mental and emotional, psychological work, can help improve our physical symptoms. So you want to identify what are your stressors, create a plan to cope with it, whether it be exercising, meditation, talking to someone, going to therapy. Create a plan. We truly want to live a healthier life. Doesn't mean that we're going to be happy all the time. We're going to have challenges. We're going to face things. That's the only way we grow. Certain challenges, we should be open to it, because again, that's the only way we evolve in life. And yeah, I love you guys. If you have any questions or concerns, drop a comment below. So till next time, bye.